Hi. In this video, I want to address the evidence that links dietary protein to certain health effects. Now, eating lots of protein is currently quite popular and is a recurring topic in women's and men's health magazines. A high-protein diet is promoted by many nutrition coaches and by many best-selling books on nutrition. And it's widely assumed that a high-protein diet is beneficial when trying to lose weight in order to suppress hunger feelings and maintain muscle mass. But what is actually the experimental evidence to support consumption of a high-protein diet? And could it actually have detrimental effects? Now, there are reports that claim a link between high-protein intake and numerous chronic diseases, including heart disease, certain forms of cancer, and osteoporosis. But is there any experimental basis for these claims? Now, Peterson and colleagues, they made a careful overview of the literature in a recent so-called systematic literature review. And they classified the evidence for dietary protein and certain outcomes from convincing all the way to unconvincing. And surprisingly, none of the evidence linking dietary protein to a certain outcome could be classified as convincing. And the evidence was assessed as probable to convincing for an inverse relationship between soy protein intake and LDL cholesterol. It was classified as suggestive for the relationship of total and animal protein intake with increase for risk of type 2 diabetes, for an inverse relationship between vegetable protein intake and cardiovascular mortality, for an inverse relationship between vegetable protein and blood pressure, and for an effect of physical training on whole body protein retention. Now, the evidence was assessed as inconclusive for the impact of physical training on protein requirement, for a relationship between protein intake and cancer mortality and cancer diseases, bone health, energy intake, body weight, body composition, renal function, risk of kidney stones, cardiovascular diseases, and all-cause mortality. So what it means is that in general, the scientific evidence to support specific health claims of dietary protein is very limited and weak. And one of the reasons may be technical, in the sense that people and populations differ relatively little in their protein intake, which makes it very difficult to study the effects of dietary protein via observational studies. Finally, it should also be mentioned that there is one group of people that clearly should not increase their protein intake, and those are people that suffer from kidney disease. And the reason is that the high protein intake may cause further damage to the kidneys. Now, what about animal protein and plant protein? And some observational studies have suggested that high consumption of animal protein may be linked to certain chronic diseases such as cancer, whereas consumption of plant proteins may be protective. Now, it's highly unlikely that the different effects of animal versus plant protein can be explained by differences in amino acid composition or digestibility. It's also unlikely that plant proteins as a whole have different functional properties than animal proteins. For example, soy protein has been shown to lower plasma cholesterol levels, but these effects are specific to soy protein, and they cannot be extended to all plant proteins. Now, the most probable reason why animal proteins fare more poorly health-wise in observational studies compared with plant protein has nothing to do with the protein itself, but is because of what comes along with the animal protein, and that's saturated fat, cholesterol, no fiber, and, for instance, lots of salt. In contrast, plant protein is accompanied by fiber, unsaturated fatty acids, and numerous bioactive compounds. And it's this so-called protein package or protein correlates that likely account for the observed relationship between animal protein and health.